Hi everyone, welcome to OET 369. Today we are back with another role play card. My name is Asha.
My name is Dennis.
So this role play card was requested a lot by our candidates and our students. This was asked in one of the recent OET exams, and the candidates I think struggled a lot with us. So we actually decided that we will do that today. So I've got here Dennis with me. So he's a medical student who has kindly agreed to do this role play card for us. Okay, so would you mind explaining the situation for them?
Sure. So the situation we have today is we have a patient with high blood cholesterol and we need to take a blood test. Unfortunately, the patient has a needle phobia and our job is to convince him to take the blood test.
Exactly. Okay, so shall we start?
Sure, let's go.
Okay. Good morning.
Good morning.
My name is Asha.
Hi.
Would you mind if I just confirm your details, please?
Yes, my name is Dennis.
Okay, Dennis. Thank you. And do you mind if I ask your date of birth, please?
It's 1998, 27.
Okay, 27th
10th,
1998.
Yeah.
Okay, lovely. Thank you. So, Dennis, I have recently received your blood results from your GP, and we have identified that you've got a bit of high cholesterol in your body. So, we would like to do more blood tests on this,
Okay.
so that we can examine what's exactly going on. Is that
Okay.
all right if I take some bloods from you?
Actually, the thing is I have a bit of a phobia of needles, especially it just freaks me out. So is there any other way we can do this?
Oh, I'm so sorry to say, unfortunately, we don't have any other ways. This is a basic test that we need to establish. I understand that certain people are phobic. This is quite common these days. But I can tell you that blood test is quite a common procedure. I think in the old days, people used to do insert with old, big needles. But now we use a tiny needle, and you won't even feel it. So I'm sure that you'll be fine. Do you mind if I go ahead?
Well, the thing is, I've read on Google that sometimes you can get infections, sometimes there can be vein collapse. I'm just really worried about it.
Oh, right. Okay. I have even read about that. Yes, there are loads of things. And I do agree to some extent that these can cause infection. But I can assure you that we actually use new needles for everyone. So they are actually single-use needles.
Oh.
So if I use that for you, I won't be using that for any other patient.
Oh.
So the chances of infection is very, very minimal.
Okay.
And I can also tell you that we nurses always make sure that we clean the site to avoid any infecting equipment or infection entering into your bloodstream.
Okay.
So we always make sure that your the site is cleaned before we actually insert the needle into you. So the chances of infection is very less.
I mean, that's all well and good, but still, is there any other way, like I could, take tablets, I'm fine with that, or if there's any other, screening techniques or imaging procedures?
There are lots of scans that is available to make out this, but we can't obviously decide which scan to do unless we do this blood test. Okay, so this is the basic test that we do for all the patients, and I understand that this can be a bit scary, but I can tell you, once when I insert the needle, don't look into the needle. You can just we can divert that with you with some little bit of music if you like that.
Okay.
Or we have even got stress balls, so you can actually divert your mind by just squeezing that ball and things like that, and it has actually worked for many people.
Okay.
So we can actually try those options and see that how it goes probably, and I think it's really important for you because we then need to establish what treatment we can do for you, because you know that cholesterol is a very dangerous situation that we can come across. So if we treat that in the initial period, that will be great help, and that will protect you in future and to avoid any complications. So I personally think you definitely should go for this.
Okay. I mean, since you have had many other patients who've had the same phobia as me, and if they've got along with it fine, then I'm sure that I probably won't have a problem.
Exactly. And I can assure you that I can make you comfortable before even we start the procedure. We can set up the diversional therapies rounds, and we'll just have a go. But in the meantime, if you have any problems, let us know. And I would also like to highlight that just in case if you have any problems like any redness or itching in the future, the thing that you have to remember is you need to seek the medical attention. So you can actually go to your GP or the community nurse. So they can look into it. Well, it may not be an infection, but just to rule out any possibility. That is really important. Okay. So shall I go ahead, please?
Sure, let's go ahead.
That's great, Dennis, and thank you so much for understanding this, and thank you very much for letting me do this. I'm sure that you'll be fine, and thank you.
Thank you.
Good luck. Right, guys. So Dennis here was a really young student who was really scared of needles, and my job as a nurse was to convince him for this blood test. And I think it went well, Dennis, isn't it?
I think it was fine, yeah.
Okay. So I hope and we hope this video was useful for all of you. If you have any specific roleplay queries, you can email me at oet369@gmail.com. For our online course details, you can WhatsApp me. I've included my WhatsApp number with the description, and we'll try and help you out more with the roleplay cards. And thank you so much, and we hope to see you all soon. Keep on supporting OET369. Bye bye.